fight against COVID-19 is seeming to be not getting over. From the virus and its new variants that have created a havoc to other infections like the black fungus affecting people, doctors are now warning about the dangers of a lingering post-COVID syndrome that is putting patients at risk even long after testing negative. So what exactly is long COVID and how does it impact the patients? Here's what the doctors have to say.
Most of the patients suffering from COVID-19 usually recover within a month of getting the infection. Some people continue to have persistent symptoms after 1 month of suffering from COVID. These symptoms can persist for as long as even up to 9 months, and this is called as long COVID. Now, patients with these long COVID presents with various symptoms. They can come to you with cognitive difficulties, which is called as brain fog. Patients may have anxiety, they may have depression, they may have tingling, numbness, they may have loss of taste and smell. There can be persistent fever, sore throat, dry cough, breathlessness, and many more non-specific symptoms.
India Today magazine spoke to some COVID patients who've been affected by long COVID. This is what they say.
I came back after 15 days of hospital stay back home, but still my levels were between 94 and 95. But more than that, I had problems with while walking, while doing any kind of strenuous activity. Even after coming back from hospital, the problem was that breathlessness remained. Secondly, all the memories were vertical. There was no coherent correlation between one memory to another.
The major complication that I faced during and after Corona was a lot of palpitations. It still reoccurs once in a while, and I had ongoing fever for about 20-25 days, which I couldn't resolve, and I got in touch with a few physicians, and I was put on another course of antibiotics, which I thought was not really going to make sense in the longer run. My digestion went for a toss, which I'm still working on, and I think is the key eventually to really feel better about myself again.
All vital organs in the body are at some or the other risk during long COVID. Some major aspects are explained by specialists.
The 4 most common complications in the lungs of the patients who recovered from COVID that we encounter are, first of all, secondary infections. These secondary infections could be viral in origin, could be because of certain bacteria, they could be because of tuberculosis, or due to fungal infection. The second common complication that we encounter are clots that develop in the blood vessels of the lungs, which is called pulmonary embolism, and this could be life-threatening. Yet another complication is leakage of air from the lungs, which is due to rupture of certain small cysts that develop in the lungs in the post-COVID period, resulting in what is called pneumothorax. This again could be life-threatening. The fourth complication, which results in increased morbidity and a prolonged illness, is called lung fibrosis. This is basically due to scarring that occurs as a part of the healing process of the inflammatory cascade that had been triggered off by the virus.
As far as kidneys are concerned, that falls into category of multi-organ involvement in COVID-19. Many times the patients of kidney involvement, the recovery period taken by them is 1 month to 6 months. Many times symptoms are also not there. You have to be, patient has to be under with the follow-up with the nephrologist, because they have to keep on checking the urine parameters and the kidney function parameters.
The medicine, mind and the body have to work together to provide wellness from the impact of long COVID. We look at some tips shared by Dr. Farah.
Most of the patients get better with adequate rest, proper sleep, proper nutrition, and proper counseling. So it is basically a holistic approach, and if required, take consultations from a psychologist as well as your physician. That will help you.
Click on the link below to read more on long COVID. For more stories, get a copy today.